tossing and turning in bed because of jet lag or insomnia? If you're someone who constantly suffers from trouble falling asleep, you must have encountered melatonin supplements before. But did you know that excessive intake of melatonin drugs causes adverse effects on your body? Hi there, mates. Welcome back to The Natural Education, where we talk about health tips, facts, and hacks that will surely fascinate you. Did you enjoy our last video about the 8 benefits of biotin? If yes, stay tuned because we're giving you another informative video that will undoubtedly keep you up to date. In today's video, we'll talk about the 7 side effects of melatonin. Melatonin is a natural sleeping hormone produced by the pineal gland in our brain. It helps us enjoy a sound and good night's sleep. Melatonin aids the circadian rhythm in humans, which regulates our sleep-wake cycle. This sleeping hormone signals our brain to fall asleep during our regular time for bed. Darkness triggers melatonin production, and that is why we are commonly advised to sleep in a dim or dark room to fall asleep faster. On the other hand, bright lights disrupt melatonin. Have you ever been advised by an expert to turn off your computer or mobile phone an hour before bed? It is because the blue lights can slow down melatonin production. For some people, excessive doses of melatonin can cause discomfort to the body if taken in for an extended period. Here are 7 side effects of melatonin that you should be aware of before purchasing the over-the-counter melatonin supplements. Number 1. Headaches. Melatonin is generally beneficial to our health, especially for short-term use. The prescribed intake of melatonin for adults is 0.5 to 10 mg a day, and the best time to take it is 3 hours before bedtime. However, anything that exceeds that can lead to your body reacting to unusual chemicals that enter your system. Headaches are a common side effect of melatonin. Since our body is responding to a new drug, the natural melatonin produced by the brain is adjusting to the oral melatonin to keep the balance. Headache and dizziness might also come with vertigo. Number 2. Drowsiness. Oral melatonin can cause drowsiness or the so-called hangover effect. Experts advise people to take oral melatonin to avoid driving or operating machinery within 5 hours after its intake. Drowsiness can reduce alertness and cause people to lose awareness of their surroundings. The feeling may be compared to a light drunkenness when we tend to lose concentration on what we're doing at the moment. Like the other side effects, it will eventually go away, but you might want to stay still on the couch before it ultimately happens. Besides drowsiness, a feeling of daytime sleepiness may also indicate too much melatonin intake. Before you doze off, don't forget to give us a like if you're finding this video helpful, and consider subscribing so you won't miss out on the next videos we will upload every week. Want to stay updated? Hit that notification bell for more. Number 3. Nausea and vomiting. Like other prescriptive drugs that we take for the first time, our body tends to react to a melatonin supplement that we are not used to. Being dependent on melatonin for a long time may cause an upset stomach in some people, which results in throwing up. Our body reacts because it is not the natural sleeping hormone produced by our brain. Besides nausea and vomiting, melatonin may also cause diarrhea. Number 4. Mild tremor. Another side effect of oral melatonin is mild tremor. You might feel involuntary shaking or trembling in your hands, even when doing simple tasks. This is also why you should not drive after melatonin intake to avoid messing up on the road. Shaking will eventually go away after a few hours, but you should be careful about how much melatonin you take next time. In addition, these mild tremors might lead to seizures in children. Health professionals advise that young children avoid melatonin intake unless a doctor recommends it, though several studies say that there have been no serious side effects attributed to melatonin. People are still advised to take melatonin in small dosages. We're down to the 4 side effects so far. Have you ever experienced any of these adverse effects before? Share your stories in the comment section, and we'll tell you more tips on how to overcome them. Number 5. Restlessness and irritability. Restlessness is another downside of melatonin drug intake. Adding too much melatonin for our body to process may also cause irritability and mood changes. Since our brain readily produces melatonin to help us relax at night, interrupting this natural process can make us feel restless. Imagine taking in melatonin to make you feel relaxed after a long weekend's work, but end up staying up all night. The opposite effect will undoubtedly get to your nerves. Number 6. Low blood pressure. Melatonin is excellent in regulating high blood pressure. However, too much of this sleeping hormone may cause your blood pressure to drop. According to Grossman's hypertension research published in 2013, melatonin may directly dilate peripheral arteries, reducing peripheral resistance and leading to nocturnal BP fall. He added that melatonin has been shown the release of tissue factor pathway inhibitor from the vascular endothelium, which may suppress thrombosis and arterial restlessness. Other studies also show that patients with hypertension who repeatedly take melatonin before bedtime experience reduced blood pressure. Number 7. Depression. People tend to be more vulnerable at night. Saying so, taking in melatonin before bed may lead you to a more depressive state if you already suffer from mental health issues. Based on a study published in 2018 about the effect of supplements on mental health, melatonin can make depression worse in some people. Since melatonin is primarily used for sleep, it lowers our mood, causing our weakened energy to contribute to depression. So, when you're feeling down next time, it would be better to talk to a trusted friend or family member about your silent battles than taking melatonin supplements that might trigger your anxiety or depression. Cry and vent out to a loved one, and it could be all the therapy you need. Did this video rouse your senses regarding the possible adverse effects of melatonin? Share this with your friends as well. It feels great when we spread some awareness to our loved ones. It's always been my goal to create a community of well-informed and healthy people. Thank you, and see you on the next natural education health story.